Hi, I'm Kristin Pelletier, founder of KP Consulting, and today I want to talk to you about your belief systems around treatments that are not covered by insurance. And I want to tell you a story about a practice that I was visiting a few weeks ago. This practice said that they believed that fluoride would be beneficial to people of all ages, not just children, but yet their case acceptance on adult fluoride was almost non-existent. So we started digging a little deeper, and I was asking them some questions and trying to figure out why, if they believed that this would be beneficial to their patients, why they didn't have very many patients saying yes to this procedure. So I started to look at some of their other codes that maybe they were getting case acceptance on that also were not covered by insurance. And it was interesting to me is that this practice had one of the highest periodontal percentages that I'd ever seen. They had a lot of people enrolled in periodontal treatment, and as you know, many of those appointments are not covered by insurance. If they have a patient coming in 4 times a year, there's a really good chance that 2 of those visits are paid completely out of pocket by the patient. So I started asking some questions. How is it that you have 2 procedures that are not covered by insurance, and one which was actually a much higher price point than the fluoride? So one has excellent case acceptance, and the other was almost non-existent. And what they discovered is that it wasn't that the patients didn't want the fluoride because it wasn't covered by insurance. The reality was it was their belief system around fluoride. They had a very passionate team around periodontal disease and how important it is to the patient, and that allowed them to really get past a lot of those objections that can come up when something is coming straight out of the patient's pocket and they're not receiving any assistance from their insurance. So they decided they wanted to change their mindset about fluoride. And what happened over the next several months just blew me away. Their case acceptance on fluoride went through the roof. Patients that had been saying no were saying yes, and it was all due to them changing their mindset around believing and recognizing that yes, this is something that they believe would help the patient. And so instead of just saying, fluoride is something that we recommend, it's not covered by insurance, is that something you'd like to do today? They put their belief behind what they were saying and said, this is a service that is very beneficial to you, and here's why. And they really started communicating from the place of really believing that this is what was best for the patient, just like they were doing with their periodontal procedures. I recommend that you take a look at any procedures that you believe in or that you say you believe in, but yet you're not getting case acceptance from your patients, and see if there needs to be a shift in your mindset and your belief system around presenting that to your patients. Please visit my website for more practice management tips, KristinPelletier.com.